So, Dr. Sandler,
Sir.
you can cure depression and anxiety.
Yeah.
That discussion, if you like. And
Well,
when
you're
you
probably down to a couple now.
in your book, in Tea with Freud, you have this hypothetical patient. Her name is Carla.
Yeah.
She comes to you. She comes to you with symptoms of anxiety, and she's not getting along with her husband or having problems with her fiance, right?
Yeah.
And then you start talking to her, and you notice you right from the beginning you can spot that she's holding back some feelings, or she's blocking some feelings.
Yeah.
And you point out certain defenses to her, like her nervous laughter and chewing her cheek. And as you do that, she starts talking about a horrible memory of domestic violence,
Yes.
of guns and knives and whatnot.
Yeah.
And she has a flood of emotion, and she starts crying. And
Yeah.
so that's what the kind of work you do.
Exactly.
Yeah.
Exactly.
Yeah. And in that chapter, you are showing that how you get to that, how you get from anxiety to all the unconscious things, and
Right.
you seem to get there pretty quick.
Well, in that case, it was quick. In the first session,
Yeah.
We go from introductions to a lot of deep feeling and a lot of discovery of what has been going on in our own mind.
Mm-hmm.
For other people, that might take 10 sessions or more.
Mm-hmm.
But she was very quick. She came in just ready to get.
So hi, so you're Carla. So we spoke on the phone for a minute or two just to set up the appointment, and you mentioned a couple of complaints, but now that we're here, tell me what what the problem is.
I guess I just feel anxious a lot.
Anxious.
Yeah.
Yeah. Nervous.
Yeah.
Yeah.
Like half the day.
Half the day. That's quite a bit.
Yeah. It's also, I'm an on the go kind of person. I'm a go.
Mm-hmm.
Never sit still.
Right.
So it's just hard. It's also hard to it's hard to feel like I'm ever relaxing.
No. Can't relax.
No.
Yeah. Is this a recent thing, or it's been like this always?
No, it's been like that a long time.
A long time.
Yeah.
Just a little nervous and can't relax.
Yeah.
Half the day. A little nervous now? Notice you're moving your hands a little bit, fidgeting a little bit?
I guess a little. Yeah.
A little bit,
Yeah.
yeah. It seems to me you also mentioned on the phone another problem with anger, right?
Yeah.
What's that about?
I don't know. I feel like I'm really, really mean.
You are, huh?
Yeah. To my boyfriend.
What's his name?
Fiance, Jimmy.
Jimmy, fiance.
Yeah.
Yeah, you're mean to him.
Yeah.
Hmm.
And he doesn't really deserve it. But for some reason, I can't help myself. I just say really mean things to him, and
Can you give me an example?
I mean, called him a loser. I told him he's a loser because he doesn't make enough money,
Really?
and he really just doesn't. It's just not fair. He doesn't deserve that.
Yeah. You call him a loser.
Yeah. I do.
What else do you say?
I tell him I'm gonna punch him in the face.
Really?
Yeah.
You threaten to punch him in the
I
face?
do.
Do you punch him? Do you really?
No, I would never actually punch him in the face. It's just,
Uh-huh.
he gets me frustrated, and he knows how to push my buttons, and
Yeah, you notice you laughing as you talk about this. The laugh doesn't exactly match the topic, huh?
no, it
You
doesn't.
don't punch him in the
It's
face,
just-
but there's a
yeah.
laugh and there's a little fidgeting. I wonder if there's a nervous laugh there, perhaps?
It could be.
Could be.
Yeah.
And I wonder if the laugh covers up something about the anger,
It could.
you think?
Yeah. It's just he's just like, ooh.
Your hands come up in anger,
Yeah.
but your face smiles and laughs as if to laugh it away. you know, you come in with a problem of anger. It sounds like you really have a problem lashing out in anger verbally at Jimmy. But then it also, I get the impression you may be covering something about the anger. Tense up and then laugh it off, and you know, what's the problem?
So this was a good tape. I think the acting was very good. Who's this actress? What's the name?
This is Erin Waterhouse, E-R-I-N, Erin Waterhouse. She does some acting at Albany Med, playing the role of a patient for med students to do an interview, and I found her there. She was amazing.
Very good acting. I couldn't tell it was acting, you know.
Yeah.
Seemed like a real patient. So my compliments to her.
Yeah, I will convey that.
Yeah. So like we talked, ended up last time that the obstacles for a therapist to go into the unconscious and are called defense mechanisms, and that is what we talked about in this tape when we saw Carla using some defenses. So what are defenses?
Defense is anything that will block painful thoughts or feelings or memories. And in the clip, what we mainly see is laughing.
Yeah.
Right? That she starts to talk about how nasty she is to her boyfriend, and she says, "I'm going to punch you in your face," and then she starts laughing, which doesn't really fit what's going on. Right?
Yeah.
So we can call it a nervous laugh.
Yes.
You know, just getting a little tense telling you this. We can also say, as I said to her, maybe this laugh is covering up something about your anger. That is, it's acting as a defense.
It's acting as a defense.
Yeah.
So that's something unique, right? One emotion being used to cover another emotion. So, you know, that happiness, laughter is covering over sadness, anger.
Yeah, right.
Yeah.
We learn classical defenses like denial or rationalizing or all the defenses we learn in training.
Yes.
But in training, I read a book called an elementary textbook of psychoanalysis by a fellow named Charles Brenner, who said anything can function as a defense. Anything.
All right. Yeah. So we saw Carla using that, and that was the first step in your therapy, is to find out the roadblocks.
To point it out.
To point it out.
And point it out to her, and luckily she was willing to go with it and say, yeah, I guess there could be hiding something about the anger.
Yes.
Some patients wouldn't be so agreeable and might be offended.
Yes.
But the first time I point this out and say maybe it's hiding something about the anger, she says, well, that could be.
Yeah.
You know, if we were at a party and she said, oh, I say mean things to my boyfriend, and she laughed, I would think nothing of it. I mean, we all have to have defenses to cover up and regulate our emotions to some degree, or we'd be yelling and crying and screaming all the time. We have to regulate our emotion. So at a party, I wouldn't say a thing about it, and I use humor that way at a party or laugh about something. But this is not a party.
Yeah.
This is psychotherapy.
This is psychotherapy, and this is psychodynamic psychotherapy.
Right. All the offshoots of Freud's work, including the concept of defense.
So if there was, cognitive behavior therapist, he would be talking about, how Carla is misconstruing what her husband is saying that's making her angry or anxious, and they will tell her about, well, this was a misinterpretation, he didn't mean that, and this is how you took it to be, and why he took it to be. So the whole discussion will go that side, but that's not what you are after. You know that there is something sitting in the unconscious. And that's why your first thing that you're looking out for is the defense. Right. And that's where you start the therapy, because this is just the beginning of therapy.
Yes, and there are many ways to do therapy, as we've talked about for years, and one of them is cognitive behavioral therapy, which would look quite different. I want to know what's buried in the unconscious.
Yeah. So this was the first part of this tape of Carla, in which she came in with a complaint, anxiety, and unexplained exaggerated anger at her fiance, and Dr. Sandler pointed out some of the initial defenses, like a nervous laughter, but then it gets more complicated, and he talks about more fancy sounding words like isolation of affect and stuff like that, right? And that's what we'll be talking about in the next episode, right?
Right on.
So keep watching next episode of Carla.
I just gave a little talk about what we do. Right. I'm also